Welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we're going to be talking all about Breastfeeding Month. August is National Breastfeeding Month, and here with me, I have two guests. I have Leah Jester. She's a BSN, RN, IBCLC in A3 Mother Baby and Lactation. And I also have Leah Taylor, a BSN, RN, and CLC nurse. Thank you guys both so much for coming.
Yeah.
Thank you for having us.
So, Leah Jester, you have been here before.
Yes,
under
I
a different name, actually,
yeah,
last year.
I got married.
Yay! Congratulations.
Yes, thank you.
So, welcome back. So, you were in the podcast we did kind of all about our women's center services.
Yes.
So, I can plug that in the show notes if anybody wants to go back and listen to that. But how have you been since then?
Great. Awesome. So excited for August Breastfeeding Month. We've got a lot of exciting things for the community, including a milk bank depot. We are officially rolling that out August 16th. So any moms that have excess breast milk, you are able to donate breast milk. Just call us at our office number, 731-541-2229, and we are happy to set you up with the Milk Bank of Tennessee and getting you to be an official donor, because you do need to be an official donor.
Okay, cool.
We have Baby Fest coming up August 24th.
Mm-hmm.
Yeah. And Leah Taylor will talk about that later. And it's breastfeeding month. So we have goodies for our moms that are choosing to breastfeed that deliver this month in August, and some good information for them too.
Right, yeah, and that's always good for the month of August, all the cool things you get.
Right.
So, Leah Taylor, this is your first time being here. Nice to meet you, and welcome to the podcast.
You. Thanks for having me.
Great, yes. So, how long have you worked for West Tennessee Healthcare? Kind of give me a little bit of your
I've
background.
been for West Tennessee Healthcare on A3 Mother Baby for 5 years, and then I've been with Lactation Services for about a year.
Okay, great. So, for August being Breastfeeding Awareness Month, I don't know if we talked about this last time, but what does it mean to you? Did you start out in A3 Mother Baby? What has your career has taken you, and what do you like about it?
Yeah, so I started at West Tennessee Healthcare on Mother Baby, straight out of nursing school, started there. And then after I had my son, almost 2 years ago, it really gave me a passion for breastfeeding, and that's when I transitioned over to Lactation Services.
Okay, great. So actually becoming a mother yourself.
Yeah.
Having to go through all that, so you
Absolutely
can help. I was going to say that's got to help.
Now that I'm on the other side of it,
right,
I can help.
So I had a question. We've got BSN, RN, IBCLC. What do those letters mean?
BSN, that translates to Bachelor of Science in Nursing. All nurses that have a nursing license, can either be a registered nurse or a licensed practical nurse. Okay. So it just means we're registered nurses. IBCLC, that stands for International Board Certified Lactation Consultant. It just gives you more of a scope of practice than a certified lactation consultant.
Right.
And we are required as lactation consultants on A3 Mother Baby in the hospital to get that certification within 2 years of starting. So, yeah.
So, specifically for your jobs,
yes, correct.
That is such an important thing especially when you're helping people. And I assume that there's a lot of troubleshooting with that.
All day. Definitely.
I want to say probably no case is the same. And
no, not at all.
Yeah.
We're using our brains a lot and learning a lot.
Yeah.
There's always new research out. So we try to stay.
Right, yeah. So specifically with breastfeeding, I know there's a lot of rumors and myths.
Yes.
A lot of
debunking those.
Right. Maybe sometimes someone is like, I've tried, it just isn't for me, or how long to go. Kind of what are some things that you get a lot maybe that you want to
A big thing I get is, I saw on TikTok.
TikTok.
Yeah, a lot of things about, my milk isn't in yet. I don't have any breast milk. And so they're like, I'm going to breastfeed, but not until I get home. So I feel like it's a lot of re-education and letting them know the facts of what they can do.
Right.
And empower them to actually breastfeed if that's something they really want to do.
Right. And not just in the hospital, but like we talked about in the last podcast, was we've got classes through our women's center where, there's postpartum, There's sibling classes, all kind of things. So what are the ones do we have one specifically for breastfeeding for after?
Yeah, we actually teach those. I'm actually teaching a class tonight.
Okay,
it's the first Thursday of
I
the
see
month.
a lot are coming up in August. Yeah.
So West Tennessee, people can go on WTH.org
/event, and you can do /events, and you can see a list of them.
Yeah, that'll take them to that page, and they can register if they have any questions. There's a phone number they can call, but we offer that to the community.
Right. Yes.
So it's open to everybody that wants to take a class on breastfeeding. I definitely encourage bringing a support person so that they can support you, because the number one reason moms continue to breastfeed is because they have support.
Right.
Moms that don't have support don't breastfeed it for as long. So that's why we're really
and you
focusing
can maybe
on community outreach.
For your own personal, you can maybe work with someone on how long you should, or how it's going with you, or how you're doing. Yeah, we meet moms where they're at. We see what their goals are for breastfeeding and just want to support them. We're like little cheerleaders. So and in terms of like the lactation side with the Milk Bank of Tennessee, so how did that get started? With that starting this year. So that's an update for us.
Yeah, definitely. So it's been a process in the making. It's taken about
2 years.
2 years to get rolling. But what it's going to offer for the community is moms being able to support other moms and babies that are a little disadvantaged. They're critically ill. Mainly they'll be in the NICU. This is the Milk Bank of Tennessee is an accredited organization. They're non-for-profit as well. And so their whole mission is to provide safe, pasteurized donor human milk to most vulnerable babies in the state of Tennessee. So there's several in the state of Tennessee. There should be more because there's such a great need. Babies that are born prematurely or have any medical conditions, they really benefit from breast milk.
And I mean, maybe if you have trouble producing,
that too. But that's how it came about. We were very baby friendly. We've been baby friendly for the past
hospital.
Since 2017. So we really, really encourage breastfeeding, and so why not be a milk drop depot? So moms can bless other families and really be able to help out all the babies in Tennessee, babies and moms in Tennessee.
And especially, with like the formula shortages. And knowing that the breast milk is so much more nutritional than the formula.
Yes, definitely.
Being able to have that as an option is great.
Yeah, and it's recommended by most neonatologists, doctors that work in the NICU for a baby to receive breast milk. It's the most recommended source of nutrition. So that really just drove me wanting to do that, open the Milk Depot Bank.
Great. So Leah Taylor, see, I'm having to both call you by your full names because we got two Leahs and a Kara. So since you've been here and you've been working on A3 Mother Baby, what are some milestones maybe, or some things that you've seen that have really maybe touched you or been important to you?
I know that we have been baby friendly since 2017, and we recently got our redesignation for that this past year.
Yes.
So that's been a big thing, just continuing all of our standards and making sure that everything is the way we need it to be for baby friendly. But then also working with Leah to open the milk bank. She's been working so hard on this for almost 2 years now. And just to see that finally come to fruition here in a few.
August 16th.
August 16th is our
That is exciting.
Just I'm getting to see these moms benefit from this is going to be amazing.
Yeah, and it's helping the community. So I mean, what's not to like? And I'm going to need pictures because I'm going to post those on social media.
Yeah, I've already got a photographer set up.
So we'll definitely be sharing that on our socials.
Amy Garner, she's aware. Yes. She'll be there. So
that's such an exciting thing. Yeah. To come here and to come to Jackson. So that's such a great thing to have. So now also in the month of August is such a big month, especially
busy month.
For Breastfeeding Month. So we've got Baby Kids Fest. Do you know how many times we've done it?
It's every 2 years.
Every 2 years. Okay. So we didn't do it last year. So this year it's coming up. It's going to be at the Fairgrounds.
Yes, it's at the Fairgrounds on August 24th from 10 a.m. to 2 p.m. So it's at the Jackson Fairgrounds Park. Yes. So it's a fun educational event for children, all ages, their parents, caregivers, and expectant parents. So moms that are pregnant, haven't delivered yet, it's for them too. So it's designed for the community to gain knowledge about kids' safety, education, and then, of course, lactation. We're going to be there having a booth, community resources for everybody.
So there's going to be vendor booths,
Vendors, games.
So there's businesses in town that offer services
Absolutely.
to babies, children, and then you guys, us from West Tennessee Healthcare. So I believe it's a free event.
Yes.
So just come on in,
Come on in, have fun.
no
It's a lot of
charge, and
fun.
so
It's going to be awesome.
so that'll be great. Okay. Well, guys, is there anything else that I forgot?
No,
Or that I missed? I know.
thing. Oh, yeah.
I was going to say, I know
I got one thing.
Leah's
to
got
say.
some papers in her hand from the U.S. Breastfeeding Coalition.
Yes.
I have been to that website.
You remember.
So that's one of the resources we like to give, and I'll
Yes.
share that because that website's got a lot of information.
Yeah, it just has some information about National Breastfeeding Month. The theme for this month is Nourish, Sustain, and Thrive. So it's just trying to shine a light on why protecting, promoting, and supporting lactation is so important for the human life cycle. And the U.S. Breastfeeding Coalition's wanting to honor the incredible work that lactation consultants, organizations that support breastfeeding are doing to make breastfeeding a little bit more friendlier for families and not as kind of taboo in the public eye. So we're just trying to support, and how perfect we're supporting our critical babies in Tennessee. There is a little statistic I want to share. Currently, one in nine babies in Tennessee that are born before their term, which means before 37 weeks of gestation. So we have one of the highest preterm birth rates in the nation. So this milk bank depot is going to be such a great benefit to the whole state of Tennessee.
Right.
So
and I know people who there's a kind of a stigma around if you breastfeed, if you struggle to breastfeed, if you don't want to keep breastfeeding. There's a lot of stigma and maybe shaming about that. So
and
I definitely
no need.
I was gonna say I definitely want us to say, wherever you're at, whatever your situation is, and especially with this milk bank, it's like whatever you have to do for you, we have resources for you.
Exactly.
No matter what. And so anybody that if you've ever had to formula feed. I was a formula fed baby from the late 80s, so they didn't really try that hard with my mom. She was like, it's not working, and they were like, here's some formula. So wherever you're at, but these are such great resources. And from the 60s, 70s, 80s to now, the amount of great new things that have happened and the amount of research and
information and
just
the tools that we can use
Exactly.
to help moms and support moms.
Especially for people who struggle. It's not even the same as before. So anybody who's planning to become pregnant or pregnant now, it's not scary like I think it's maybe historically people are
and so many tools, like she said, that we can help moms.
The more information you have, the better.
And
the less anxious you are about something new in your life, definitely. The more informed you are. And we just want to support all moms.
Exactly, No shaming, no judgment. We just want everyone to live happy, healthy lives.
Yeah. Perfect.
All right, guys. Well, thank you guys for joining us and giving us a lot of updates on some of the cool things we've got going on at so this is at Jackson-Madison County General Hospital, A3 Mother Baby.
Yes.
And so I'll plug in everything we've got. It's wth.org/events if you want to see any of the Women's Center classes. The Milk Bank is coming August 16th, and then Baby and Kids Fest will be August 24th. That information is also on our Facebook and Instagram pages, and I'll be plugging all of this. And so the 541-2229 number is if you're wanting to call.
Yes, and receive
resources.
Yeah, to learn
and
more
info.
Resources and info about the milk bank and becoming a donor, or they can go online and go on milkbanktn.org, because we do require all donors to apply to become a donor.
Okay, and that's important too.
Yes, and they have to do some screenings before we accept their breast milk.
Great,
So, that's where they can find that information.
All right, guys. Thank you both so much for coming on and sharing all the great things that are happening here in August of 2024.
Thank you so much.
Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.